Let me introduce myself. I am known as prostate cancer. My medical name is adenocarcinoma. You may need to seek more advice about me with some urgency. Delaying any decision you have been given is not wise. Please do your research, but delay at your peril. I fully intend staying around for the longest time. Everything you have been told about me is true, and I will prioritize my existence over yours and take whatever I need to survive. You have been cautioned.
My name is Maisie Davenport, and I will now give you some very important information about adenocarcinoma, aka prostate cancer. Prostatic adenocarcinoma is by far the most common type and is diagnosed in up to 99% of prostatic cancer cases. About the prostate and prostate cancer. The prostate gland is part of the male reproductive system and produces fluid that mixes with semen during ejaculation to help sperm travel. The prostate is a walnut-sized, rubbery organ that surrounds the urethra, the urinary duct that carries urine from the bladder out of the body and sits directly below the bladder. The prostate gland, which grows during puberty, is considered an organ and is made up of several docile lobules or sac-like glands, held together with connective prostate tissue and muscle between them. The glands are called exocrine glands, because they secrete liquid to outside the body. Prostatic adenocarcinoma, the most common type of prostate cancer, accounts for up to 99% of cases. This cancer originates from the glandular cells that produce prostate fluid. In the UK, prostate cancer is the second most common cancer among men and is highly treatable if detected early. The risk of developing prostate cancer increases with age, and other factors such as obesity, a diet high in saturated fats, and family history also contribute to the risk. Adenocarcinoma is a type of cancer that starts in glandular cells lining the insides of organs and can occur in various parts of the body. These cells secrete substances such as mucus and digestive fluids. Sometimes, adenocarcinoma can spread to other parts of the body, a process known as metastasis. Prostatic adenocarcinoma remains the predominant form of prostate cancer, highlighting the importance of awareness and early detection strategies. An enlarged prostate, called benign prostatic hyperplasia, BPH, is common in men over the age of 40 and may obstruct the urinary tract. The abnormal prostate cell growth in BPH is not cancerous and doesn't increase your risk of getting prostate cancer. However, symptoms for BPH and prostate cancer can be similar. A condition called prostatic intraepithelial neoplasia, PIN, where prostate gland cells look abnormal when examined under a microscope, may be connected to an increased risk of prostate cancer. Prostate cancer is often caught by a doctor performing a digital rectal exam, rubbery, through a prostate-specific antigen, PSA, blood test, through a prostate biopsy or with a CT scan. Another condition, prostatitis, is the inflammation of the prostate. While not cancerous, it may cause higher PSA levels in the blood. When prostate cancer is found, pathologists stage the disease using a Gleason score, which grades the extent and arrangement of the cell mutations. For instance, a Gleason score of 6, the lowest possible, indicates a low-grade tumour, while cancers with scores of 9 or 10 are considered high-grade or the most aggressive and most likely to spread. Acinar adenocarcinoma, conventional adenocarcinoma. This cancer accounts for virtually all prostatic adenocarcinomas. Acini cells line the prostate's fluid-secreting glands. The cancer starts growing in the back, periphery, of the prostate near the rectum and may be felt during a doctor's digital rectal exam. The disease increases PSA levels. Adenocarcinomas may occur almost anywhere in the body. They form in the glandular epithelial cells that line the insides of the organs and secrete mucus, digestive juices, or other fluids. In the prostate, adenocarcinoma is also called glandular prostate cancer. Symptoms of adenocarcinoma of the prostate may include a frequent urge to urinate, painful urination, and ejaculation, and blood in the semen. Treatment options may start with active surveillance of the cancer, which generally grows very slowly. Treatments may include surgery, chemotherapy, radiation therapy, immunotherapy, or a radical prostatectomy, which is a surgical procedure to remove the prostate, may be an option when the cancer is limited to the prostate. Some side effects of treatment may include urinary problems or erectile dysfunction. Prostatic ductal adenocarcinoma, PDA. This cancer is a rarer but more aggressive form of adenocarcinoma. It develops in the cells lining the tubes and ducts of the prostate gland. When it occurs, it frequently develops along with a acinar adenocarcinoma. This cancer type doesn't necessarily increase PSA levels, making it harder to detect. An enlarged prostate, called benign prostatic hyperplasia, BPH, is common in men over the age of 40 and may obstruct the urinary tract. The abnormal prostate cell growth in BPH is not cancerous and doesn't increase your risk of getting prostate cancer. However, symptoms for BPH and prostate cancer is similar. A condition called prostatic intraepithelial neoplasia, PIN, where prostate gland cells look abnormal when examined under a microscope, may be connected to an increased risk of prostate cancer. Prostate cancer is often caught by a doctor performing a digital rectal exam, rubbery, through a prostate-specific antigen, PSA, blood test, through a prostate biopsy, or with a CT scan. In the UK, black men, including those of African and Caribbean descent, have a 70% higher risk of developing prostate compared to their white counterparts, with statistics indicating 1 in 4 black men versus 1 in 8 white men. This disparity may be linked to genetic factors, as black men are more likely to develop prostate cancer than men of other races. The data on mixed black ethnicity men and their risk levels is less clear due to limited research, and it remains uncertain whether having a black mother or father affects the risk differently. Black men over 45 are advised to discuss prostate cancer risks with their GP, even without symptoms, and to share any family history of prostate or breast cancer. Specialist nurses are also a resource for information and support. For further details on the risks to black men and research efforts to understand these risks, dedicated resources are available through all the various Cancer Charity Trust and the NHS Foundation Trust. Marshall, the CEO and founder of Optwell, strongly advises all men not to delay in seeking advice getting a PSA test, or if you have been given advice on your condition, do not delay asking questions and take action immediately. Once you are confident with the information provided to you, which will be given to you by your clinician team, the sooner the disease can be treated, and the better your outcome will be, and in some cases, you may not need an operation. Check out Optwell's website for more helpful information. This is Maisie Davenport wishing you good health.